Hello everyone and welcome back. In today's teaching, we are going to be talking about the urethra, and the urethra is the vessel responsible for transporting urine from the bladder to an external opening in the perineum. Now, the urethra differs in both male and female, but for the purpose of this class, we're going to be talking about the male urethra. So just like we earlier defined urethra, it is that vessel that is responsible for transporting urine from the bladder to an external opening in the perineum. And the male urethra specifically is also important because it transports the semen. Anatomically, we can divide the urethra into three different parts. So anatomically, it's divided into three different parts. The first one is the prostatic urethra. The second one is the membranous urethra. And the third one is the penile urethra. So let's check this diagram to see the different parts of the urethra. So this first one, labeled in red, is the prostatic urethra. This second part, very short, labeled blue, is the membranous urethra. And these long aspects, these long parts, is the penile urethra. Now, we'll be picking these parts of the urethra one after the other, and we'll be talking about them. So the first part of the urethra that I'll be talking about is the prostatic urethra, this red, and it begins as a continuation of the bladder neck and passes through the prostate gland. So this prostatic urethra begins as a continuation of the bladder neck and passes through the prostate, and it is the widest portion of the urethra. So this is the first part, begins as a continuation of the bladder neck and passes through the prostate gland, and it is the widest portion of the urethra. So having discussed that, let's go to the second part of the urethra, and this second part is the membranous urethra. So this membranous part of the urethra passes through the pelvic floor and the deep perineal pouch, and it is the narrowest portion of the urethra. So this first part is the widest, this second part is the narrowest part of the urethra. So having discussed the prostatic urethra and the membranous urethra, let's go to the last anatomical division of the urethra, which is the penile urethra. This black aspect is the penile urethra, and this penile urethra passes through the bulb and the corpus spongiosum of the penis and ends at the external urethral orifice. So it passes through the bulb and corpus spongiosum of the penis and ends at the external urethral orifice. And in the glans, this is the gland penis, this is the head part, the urethra dilates to form the navicular fossa. So once again, the urethra is responsible for transporting urine, divided into three different parts anatomically: the prostatic urethra, the membranous urethra, and the penile urethra. This is the first part. It begins at the continuation of the bladder neck and passes through the prostate gland. It is the widest and the most dilatable portion of the urethra. The second part is the narrowest and the least dilatable portion of the urethra. Then this passes through the bulb and corpus spongiosum of the penis, ending at the external urethral orifice. And in the glans, which is the head of the penis, the urethra dilates to form the navicular fossa. So let's go straight to the blood supply to the urethra. Now, different parts of this urethra, they have different blood supply. The prostatic urethra is supplied by the inferior vesical artery. The membranous urethra is supplied by the bulbourethral artery, while the penile urethra is supplied by branches of the internal pudendal artery. So once again, this prostatic urethra is supplied by the inferior vesical artery. The membranous part, which is the second part, the least dilatable and the narrowest part, is supplied by the bulbourethral artery, while this last part, this penile, is supplied by branches of the internal pudendal artery. So let's go to the nerve supply of the urethra. The nerve supply of the urethra is by the prostatic plexus, and the lymphatic drainage. For lymphatic drainage, it's very important to notice also the prostatic and the membranous urethra, that portion, they drain into the obturator and internal iliac nodes. To the clinical relevance, one of the most important clinical relevance is urinary catheterization, and this is the process of inserting a tube through the urethra going into the bladder. I hope that with this you understand the anatomy of the urethra. So please, if you have any question, do well to let me know, and don't forget to subscribe to this channel. Thank you so much.